Hi, I'm Mike Barber. I'm the Executive Director of the Pennsylvania Chiropractic Association. And today we're here to introduce a brand new strategic business partner with us, Impact Health Sharing. Now, one of the goals of the PCA is to find the best opportunities for our members to help them find ways to save on their bottom line. And we know that healthcare is a real concern for a lot of our practitioners as they are independent and it's difficult to find insurance. Currently, there's a bill called HB 555 that is going through the state. It's still in committee, actually. But HB 555 will allow for associations such as ours to negotiate on behalf of the entire association for insurance. It's not ready for vote yet. It's not ready to come out of a committee yet. And in the meantime, we were looking for an opportunity, especially as we're coming up for the renewal period for insurance, to give some type of opportunity for our members. So today I'm joined with Patrick from Impact Health, and he's going to share with us about the program that we're bringing on. It is not health insurance, but it is a health sharing plan, and it's a real opportunity, I think, to save money for our members. Patrick, thank you for being here.
Hey, great to be here, Mike, and thanks for the invitation.
Patrick, what is Impact Health, and how does it work?
Impact Health looks, feels like health insurance, but it isn't. It's a nonprofit platform that pays the medical bills of the members. So when somebody needs to go to a doctor or God forbid they need any sort of treatment, Impact will step in and actually pay the medical bills, similar to what all of us would know in a traditional commercial insurance type setting.
I guess I need more information. How does it work exactly? So I just send my bills in and someone's going to help me pay for them?
So, great question. So, we look and feel like a normal commercial insurance company. So, the customer gets a card, they walk into the card, you can see the provider fees all on the card. This happens to be my own. You can see on the back, we have an EDI payer ID. So, we've got an open network. What that basically means, Mike, if somebody wants to go to Danville or Hershey Medical, or maybe they want to go to John Hopkins, we've got an open network. The customer can go and see what their pricing would be to be a member. I was formerly with an insurance provider that I was paying as a business owner, like everybody who's listening, $2,700 a month for my family of four. When Impact was introduced to my family, I went to $628. So
Wow.
not only did I save $2,000 a month, that was 3 years ago. I've been saving $2,000 a month, but my what we would know as a deductible went from 6,000 per family member down to 2,500 for my entire family.
How many members are there to Impact Health nationally about?
Great question. We're pushing over 20,000 as we record this today. So we're excited. We're 5 years in business, paid over 143,000 claims, made it through COVID and the Black Swan and all the things that we had to deal with. But we're having tremendous success. And a lot of that is really people looking for something a little more affordable, especially independent people like myself and others that are a little frustrated with the increases of healthcare, as we all know.
Now, we're the Pennsylvania Chiropractic Association. So can you tell me what Impact Health, how they view chiropractic, what kind of benefits are there for participants and patients to seek chiropractic care?
Look, we've embraced the chiropractic model since the beginning. Our members actually per family member has up to 50 visits a year, which is exciting for people that do want to go see their chiropractor. We also have what's called healthcare credits. So up to $100 a month off of any vitamins or supplementals or even gym memberships, somebody could take and put it a credit towards what we would know as a deductible.
So how does one become a member of Impact Health? What's the application process? Is there a physical?
So we do not do underwriting. So you go right to the website. You can quote yourself if you're a single person, or maybe there's two people in your family, or maybe you're like me, four people total in my family. You can see what that price would be. You can pick what we would know as a deductible. We call it a PRA. But again, the benefit is the customer can pick what they want. It would start at the beginning of the month. Now, let's say they had questions. What about colonoscopies or mammograms or questions that people typically would have? They can request info, and somebody from our office of Impact Health would reach out to that potential member, answer any guideline questions, and be able to see if it's a fit for them. We do a 36-month look back when a bill does go in, just to make sure that they didn't have that problem before membership. So we do have what we call a 36-month look back for somebody that unfortunately might be sick now and then want to become an impact member. We just want to make sure that they are relatively healthy coming in the door.
What doesn't Impact Health cover? I come in, I want to be a part of it. Is there something that Impact Health just doesn't cover, period? And we should know about that before we can go through the application process.
What's unique about our offering is we've got some guidelines, pretty simple to read. We will cover things like a doula, right? Or childbirth at home. Not that I'm saying people are moving in that direction, but I know there are people that is a request that people do have, and we will fully pay for any of those type of services.
If I had a practice and I wanted to cover my staff, can I do that, be a single payer and cover multiple people?
Yep. So we do have a group option right on the website where somebody could request a group quote, three, four, five people. A group is two or more. So if they do want to offer this to their staff and even subsidize it to whatever degree, whether it be a 90-10 split or 50-50 split, the practitioner can figure out what that would look like specifically for their office, but that option is available. Or the individual themselves could go to the website, just sign up as a family or an individual and get the same benefit. There's not a price change from a group from an individual.
How does this sounds like a almost a little bit too good to be true? And so that's what kind of got us excited about this. How does Impact Health balance the cost effectiveness of comprehensive coverage with it not necessarily being comprehensive coverage?
Great questions. And I asked a lot of these myself. You and I are on the same page. First of which, we're actuarially driven. What does that mean? That means we look like insurance, we act like insurance, we create a reserve, we know how many people we have, how much we have to have in a reserve to pay everybody's medical bills. God forbid if something were to happen where everybody needs medical attention. Where the savings come in is because it's nonprofit. So healthcare sharing has been synonymous just in the Christian community, and they've done it very well. The challenge was you had to be a Christian to get in. We do not require a certain religion to be able to go into Impact Health. So it's a really come one, come all approach. But the nonprofit, the transparency of the books, how much we've collected, where the money's going, every member gets to see that real time. So this is a tech platform that they brought in. I like to consider it like an Uber, where you can actually see what's happening in real time, which is pretty exciting. And at the same time, we see how many medical bills are being paid, how many people, unfortunately, are under some sort of medical care where their bills need to get paid. All of that is transparent to the member themselves.
I'm going to play a little what if game with you. I hope you don't mind. What if I have a really serious accident, and which is going to require me to be in the hospital for months at a time? How do I know that Impact Health has got me?
That's a great question. A couple of things. One, we've already paid 143,000 claims. I like to look at what you've done to determine what we're going to do. Second of which is catastrophic does happen. Unfortunately, cancer will happen. Organ transplants will be needed to take place. NIC units are probably the most expensive we've seen in our 5 years. And all of those got paid. There's no lifetime spending limit. Unfortunately, if somebody does get into impact where they're going to need constant care moving forward, they're able to go do. Second of which, we do also provide at no additional cost WebMD. What we find is that's a really unique option for people with kids. I fall into that category where I don't want to put my kids in the car just for a doctor to say, hey, you need a little prescription to get the virus or whatever they might have. So we find that the WebMD is very useful. But to answer your question, as mentioned, we've already demonstrated over the last 5+ years that we do pay all medical bills. And unfortunately, some of those have been cancer bills, Mayo Clinic bills, Cleveland Clinic bills, John Hopkins bills, which are some of the big names that all of us here would probably know.
Let's say right now I'm excited and I want to join Impact Health. What do I do?
We've provided a really unique option for the chiropractic community of Pennsylvania. They're going to be able to go a couple things. One, quote themselves so they can see real time what they would pay or maybe what they would pay for a staff. Number two, the guidelines are already on there. So some of those questions that I'm sure some people might have, will be very easy for them to read. 3, you can request info, let one of our trained member support call that office staff member or even the chiro themselves, and they can ask any question that they want. We're nonprofits, so of course we're going to be completely transparent. There's no ulterior motive here. Our whole vision is to take care of our members, to provide affordable health care, and to be able to do it in a way that honors going to whatever doctor you want, honors even the holistic space where people can now take money off their deductible for eating vitamins or going to a gym or just living a healthier lifestyle. We're really honoring people that are moving in that direction.
That's great. It sounds like a fantastic program. I'd like to invite Dr. Keith Miller into this conversation. Dr. Miller is a former president of the PCA. He has been a member and actually a practitioner with Impact Health. And so I want to hear from really both of you about Keith, what is your experience with Impact Health in accepting it? Because clearly, if docs can use it for chiropractic, then we're going to want to have docs start accepting Impact Health so that they can serve chiropractors. So Keith, can you elaborate on how that works?
Yeah, absolutely. I, like many other people, when they get out of school, when we leave chiropractic school, we understand the basics of teaching our patients about health. We understand how to treat the patients, but a lot of us don't understand the actual business of healthcare, and it's a trial by fire for a lot of providers out there. My second job, where I am now, and I've been here since, the community where I opened this practice here after 1 year of being an associate, was a lot of old Mennonite community. I'm in the eastern part of Pennsylvania on the border of Bucks County, Montgomery County. And it wasn't long into care before I started to have patients come in with a healthcare sharing. And at first, I put my hands up like, whoa, I've never heard of this before. And I was worried it was an issue. But then I found out very quickly that a lot of the churches in my area had the program set up because essentially they were trying to make sure that the people in their congregation were covered for healthcare. They felt a lot of people who were either underemployed, single moms who were working part-time, some people who were in that transition between when they ended their career but haven't quite made it to Medicare yet. There was a lot of people in their community who were not being covered with health insurance. The Christian community had created these programs. Now, what was interesting to me was I always felt, why don't they do this in the private sector? And the reality is that they didn't do it in the private sector because we all thought of insurance as the way the private sector worked. As I started hearing about it and as time went by, I started participating in some of those health share programs. And I found it was really easy. And it was like almost like a secret because nobody knew about it. We all knew about Blue Cross and Aetna and United and stuff like that, but nobody knew about these programs. And once I got into it and people started finding out that I accepted it, I started getting referrals from other people in those communities. And as we all know, they're pretty tight communities. And I started seeing patients. And what I liked about it is that I didn't have to deal with, in part of my language, the BS of the insurance carriers. I didn't have to do pre-authorizations. I didn't have to send in documentation. I didn't have to worry about my metrics being under a certain number. I'd be dropped in tears or kicked out or have to justify my care. What I also liked about it is because I'm a practice that tries to move people from acute care onto wellness care. One of the nice things is that, especially in this particular program, Impact, once I found it, is that they give you credit towards your deductible. And one of the things you find is a lot of people, they feel like if money's going towards their deductible, if you're billing their insurance and it's going towards their deductible, they feel like even though the money's coming out of their pocket, I'm going to do the fingers a lot because there's a lot of that goes on. I'm just quoting my patients, don't blame me. But if they feel like the money's coming out of their pocket, they're not getting credit towards their deductible. So it's harming them. So people weren't coming in for wellness care because they only wanted to come in when it hurt so they can get credit on their deductible. And what's nice is that we can move people from acute care where we're billing their impact, but then we're like, hey, look, you're doing good. We're going to see you for a checkup next month. And that checkup, that maintenance visit that we see them on, that wellness visit, while they're not getting paid by the impact share, they're getting credit towards their deductible. So they feel like, in essence, it's like an insurance model that every visit counts and they're benefiting from all those visits. So if they're on a once a month care plan, and they're getting credit up to $100 per month towards wellness services. They can come into my office, they can get their wellness checkup, they can pick up their probiotics or their vitamins, and then they submit that through, and all that stuff is then covered under the deductible. So they're getting credit down towards that. So when they do have an acute care episode later on, they don't feel like they're paying for the program and they're paying for the wellness. It is the same pool it comes from. So I stumbled onto it by accident only because of the community I'm in. I went from the religious-based to also accepting the private-based. And honestly, given today's insurance market, it's been the easiest thing I have to deal with. So I have nothing but positive to say for it. It's been great for all of my patients we deal with.
As a provider, can you walk us through the steps of what it took to actually become a provider for Impact Health? And what's it like when you have to bill to Impact Health directly?
Let me start off by the contracting process. A lot of people recently had to re-contract with a certain provider. They were in that network. I'm not going to name which because otherwise I'll probably get yelled at for it. But you were in that network for 10, 15, 20, 25 years. And all of a sudden, this large insurance carrier put a contract in front of you that was optional, but made it sound like it was mandatory. And everybody panicked. And then you got this new contract, and your old contract was 42 pages. And the new contract was like, I don't know how many, it was like 3 times that amount. And none of it makes sense. It was page after page after page of legal jargon. It was take it or leave it. And essentially it said that we could do whatever we want. We could change the terms wherever we want. You're signing on now with these things that we're going to pay you, and these are the rules. But once you sign on, we could change that at any time. And if you don't like it, tough. The only option you have is to get out of the network contract. I don't remember exactly how many pages this contract was, but I think it was like 3 or 4 or 5. It was really simple. It just said that if we agreed to be in it, we would sit down and negotiate our rates. And then those were the rates that we'd have. A lot of people have a rate that they charge that is their billable rate so they can get the acceptable rate from the insurance carrier. And I always thought that was stupid, that a hospital charges $5,000 for an MRI, but they get paid X from the insurance carrier. What's nice is I could just say, look, these are my fair rates. This is what I need to get paid in order to make it worthwhile for me. We could just set that amount. I just bill that amount, and then I just get paid that amount. So it's very transparent in the sense that I know exactly what I'm getting. I don't have to play any games. I bill out. There's an EDI like every other one. It just goes out. Money comes in. I know exactly what I'm getting. It's just easy. It's basically having a cash patient that you just get a delay on your payment. And we get paid our going rates, visit average, our extra services, as long as they're medically necessary. And once again, like Patrick mentioned, you can't have a patient that's been seeing you for, a disc problem for the last 2 years. And then all of a sudden they go, ooh, I'm going to do this now, and someone else is going to pay for it. So that doesn't work. But essentially for everything else, we have a lot of people who come in that are not insured, a lot of people who are self-insured now. There's a 2024 lifestyle where a lot of people don't want to work for a company. They're day trading at home. They are streaming, they're TikToking, they're selling products on Etsy. There's a lot of non-traditional employees now, which are really self-insured. And a lot of people can't, as a single person, in your own space, get insurance. This is a wonderful way for those people to cover the gap. And we have a QR code by our front desk with a little thing. When people tell us that, we go, hey, look, before you start care, you can just sign this QR code. You can sign up for this plan. So it's not only really good for you as an office, you as the individual business owner, as a chiropractor, but you can then create that for your patients. The patients get the opportunity. And now the patients essentially have coverage in your office because it's a new problem on the very first day. And then once again, they're from the first day billing down their deductible, and they can get paid for up to 50 visits a year, plus their wellness services, $100 a month. It's been a win for everybody, and I haven't heard any complaints from anybody yet.
Keith, I'm going to ask you to wax a little philosophical for us, if you can, for a second. You're the former president of the PCA. Why is it important for a doctor to diversify their funding or their payment sources in today's day and age, especially with a health sharing plan? Why is it important for docs to start looking at this?
We've seen it recently. We've seen it before in the past where you have an office that's got 85% of their eggs in a single insurance basket, and they're cruising along, everything goes fine. And then all of a sudden, there's a new third-party administrator that comes along, or there's this new metrics program, or a new tiering program, or a new contract. And then overnight, you're watching your fee schedule get dropped. You have to see everybody at 6 visits, whether they hurt their back hanging Christmas decorations or they fell down a flight of stairs and their leg is numb. Somehow everyone's got to be better in under 8 visits or under 6 visits. And if you don't play the game, then you get knocked down into a lower tier and the copays go up and everything else. So it's been nice to have a method where I don't have to worry about certain patients. It's more and more people are leaving the insurance space as chiropractors because it's becoming almost untenable to be able to treat patients in the current climate and actually do high quality care. So I don't have to do that with this. This becomes a nice, easy way for me to start slowly growing another segment of my practice that essentially is very similar to cash practice, but works within a model that most people understand, which is a third-party payer, but it's not insurance.
Patrick, I just want to make sure I heard you correctly. Did you say how many visits does an individual get for chiropractic? Is that for the whole family or is that for the individual?
Yeah, so a great question. I love what Dr. Miller just said. Yes, it's 50 visits per family member. And what's exciting about that as well, I love what Dr. Miller said. I like the healthcare credits because I've been under chiropractic care my entire life, more maintenance than anything. So it's great to be able to know that I can take that off of my, what we would know as a deductible. And then I've also been a very avid nutraceutical vitamin taker. And now I have another option that I can also benefit from with the healthcare credits.
Okay. It sounds like there's nothing but positives in regards to Impact Health and how it can really help our patients. I want to thank Dr. Miller. I want to thank Patrick for being here and sharing with us about this. We will have a QR code connected to this video that will take you directly to the sign up spot so you can find out what it's actually going to cost and what Impact Health can save you. We'll have more information connected to this. Look for information in both our newsletter, our October newsletter. This will be featured, as well as through our social media accounts. I'm Mike Barba, PCA Executive Director, and I thank you all for being here. Have a great day.
Thank you.